Good afternoon. My name is Elizabeth Kingston, and I'm the president of the National Capital Branch of the Canadian International Council. And I'm delighted to introduce this session today, this afternoon, entitled Canadian Diplomacy and Risks to Global Economic Recovery: Impact of COVID-19 on Canada's Feminist Foreign Policy and the Global Agenda for Women's Empowerment. This session is timely, coming immediately after the most interesting and thought-provoking speech of Minister Gould. And I'm most appreciative of the fact that such a strong and able group of women have now come together from the West Coast, the United States, and the United Kingdom to present this most important topic. I will introduce the moderator, Jocalyn Clark, who will in turn introduce the panelists. Following presentations, a question and answer period will follow. Jocalyn Clark, a proud Canadian, is the executive editor of The Lancet in London, UK, where she leads the commentary section, handles peer review and series commissions, and leads the journal's recent theme issue and project called #LancetWomen. She serves as a scientific advisor to the in-depth network of health surveillance systems, Global Health 50/50, and Women Lift Health, and is an appointed member of the Governance Council of the CMAJ, Canadian Medical Association Journal. In 2014, she was named among the top 100 women leaders in global health, and in 2018, she founded the first ever Canadian Women in Global Health list. Jocalyn holds a BSc in biochemistry and microbiology and an MSc and PhD in public health sciences with gender studies, the latter for which she was a Canadian Institute of Health Research Fellow. Jocalyn is an adjunct professor of medicine at the University of Toronto and an elected fellow of the Royal College of Physicians and Physicians of Edinburgh and of the Canadian Academy of Health Sciences. Dr. Clark, if you would please introduce the speakers and proceed. Thank you so much.
Thank you, Liz, and thank you everyone at CIC who invited me. It's just an absolute delight and honor to participate in this really important event, putting public health at the heart of Canada's global engagement. That's absolutely music to my ears. As Liz said, I'm joining you today from my flat in London, England. We're in the second week of our second national lockdown. So I'm just really pleased, extra pleased to be connected to this fantastic group of Canadian leaders and all of you participants in what's so far today been a really extraordinary conference. And I promise you, this now is going to be an energizing conversation about gender equality and COVID, the topic du jour, if I may say so. So the plan for the next hour is as follows. I'm going to briefly introduce our two other speakers, and then I'm going to provide my own remarks for about 10 minutes. And then after the two speakers have presented for about 10 minutes each, I'll moderate a discussion. So please do send your questions via the Q&A function or in the chat, and keep your questions coming. We really want your feedback and your views, and we want this discussion to be expansive. So it gives me great pleasure to introduce to you Rosemary Morgan. Rosemary is an assistant scientist at the Johns Hopkins Bloomberg School of Public Health in the Department of International Health. She has a joint position in the School of Nursing. She's originally from Vancouver. She works as a gender equality and social inclusion advisor for the UK Partnerships for Health Systems program. She leads the Sex and Gender Analysis Core for the NIH-funded Sex and Age Differences in Immunity to Influenza Center. And she's the co-PI on a project exploring the gendered effects of COVID-19 in Bangladesh, Kenya, Nigeria, DRC, and Brazil, which is supported by the Gates Foundation. She's also an advisor on a CIHR-funded project that explores the gendered effects of COVID in Canada, the UK, China, and Hong Kong. And in addition, she coordinates an international gender and COVID-19 working group. And we're also really fortunate to have Julius Smith with us. She's a university research associate in the Faculty of Health Sciences and a research scientist with the Center for Gender and Sexual Health Equity. Julia is currently a PI on the Gender and COVID-19 Research Project, which is conducting gender-based analysis of the response to COVID in 9 countries, and is funded by the Gates Foundation and the CIHR. Her research interests center around gender-based policy analysis, commercial and political determinants of health, feminist theory, and community-based research. Julia has taught classes in both the Faculty of Health Sciences and Department of Political Science at Simon Fraser. She has a PhD in Peace Studies from the University of Bradford, where she also completed her master's as a Rotary World Peace Fellow. So no doubt this is going to be a great conversation. So I'm just going to offer you a few comments. As Liz said, I'm Canadian born, bred, and trained, and I work internationally in a unique position as a journal editor. And in those roles, I'm deeply interested in Canada's global role in leadership, particularly in health. And as a health person, maybe like many of you here, it's impossible to not search for health in all of Canada's activity internationally. And indeed, we saw a great deal of that in the Minister Gould's comments in the previous session when she laid out a very ambitious and very impressive agenda. Clearly, there will be no health for all unless we have successful collective responses to this pandemic and to subsequent pandemic threats. This pandemic has proved that nobody is protected unless everybody is protected. But there will also be no health for all without gender equality, without economic opportunity and stability, and without the protection of the vulnerable and marginalized, including migrants and refugees at home and abroad. And we will have no health for all without climate leadership and progressive, inclusive approaches to the global challenges that require international development and foreign aid from our country. That Canada is currently showing leadership on many, if not all of those touch points, and is doing so in an explicitly evidence-based way is really visible internationally. I would say what has been most notable is, number one, the value of science. Although it may seem so visible in Canada because it's so invisible or indeed disregarded or denigrated elsewhere. And number two, the front and center position of women public health and political leaders. I want to say a few things on priorities looking forward, for which I believe we need to look at Canada's legacy in global health. And to do so, for me, I reflect on a remarkable collection of articles that were published in my journal, The Lancet, 2 years ago. This series of articles examined the country's system of universal health coverage and its global role in health, including Canada's legacy, challenges, and future path on issues like access to healthcare, gender equality, global health diplomacy, and Indigenous peoples' health. The Lancet is one of the world's leading and most prestigious medical journals. It's been publishing weekly for almost 200 years. It had never before taken a dedicated look at Canada, and this is what it looks like. I commissioned 2 main papers from leading Canadian scholars, and they produced 2 main state-of-the-art papers that argued for accelerated Canadian leadership on health at home and abroad, and it set out a blueprint for what that might look like. The full team was led by Dr. Peter Tugwell from the University of Ottawa, with Dr. Danielle Martin leading on the domestic paper. Professors Kelly Lee from Simon Fraser and Professor Stephanie Nixon from the University of Toronto led the global paper. And I just want to share very briefly with you the summary from the global paper, because for me, it has so much resonance for where we are poised now in this globalized world, and it has so much relevance for our discussion today. So what they say is that Canada has often aspired to be a socially progressive force abroad, using alliance building and collective action to exert influence beyond that expected from a country with moderate financial and military resources. Under this government, it has signaled a return to progressive values, driven by appreciation for diversity, equality, and Canada's responsibility to be a good global citizen. However, poor coordination of efforts, limited funding, and the unaddressed legacy of Canada's colonization of Indigenous peoples weaken the potential for Canadians to make meaningful contributions to improvement of global health equity. Canada has a clear opportunity to convert its commitments to equity and global citizenship into stronger leadership on the global stage. Such leadership will require the translation of aspirational messages about health equity and inclusion into concrete action at home and internationally. To accompany those two main analytic papers, we commissioned commentaries to react to the analysis and to the challenge that those papers presented. Prime Minister Trudeau took up our invitation, and he laid out a series of bold commitments and a rationale for why his government cared about gender equality. Dr. Jane Philpott, who at the time was the Minister of Indigenous Services, she discussed the importance of Indigenous people's right to health and dignity. Dr. Tim Evans from McGill, who you may have heard a couple of hours ago on this program, and formerly of the World Bank and WHO, said that Canada had an opportunity, but really needed to back its position with more financial resources. And Professor Margot Greenwood, who's the head of the National Collaborating Centre on Aboriginal Health at UNBC, laid out challenges to health equity for Indigenous peoples in Canada. I invite you to read these papers in full. I'll put the URL in the chat box in a minute. All these papers are free to access at lancet.com/series/Canada. And I invite you to read them because I haven't seen anything of this scope and with this type of challenge for Canada's leadership be presented in this form of international platform. And I think it's worth pondering what was laid out 2 years ago and asking ourselves, what have we gained? And whether we have really met the challenge that's laid out. I think this will help us situate ourselves now and looking forward for what we might expect from our leaders. And I think those messages are really important because we're in a moment, and that moment is shaped by the profound shock of COVID and our plans for recovery. It's shaped by the results of the US election and the legacy of the last 4 years south of the border of incredible economic uncertainty and profound loss of progress in the COVID era on so many indicators of equality. So you sort of can pick your moment, and I'm sure everyone here agrees, Canada must lead even more now than ever before. The world is watching. So what things that come to my mind to think about how we kind of hitch our momentum in this moment? So just very quickly, 5 rapid things for me to wrap up. I mean, very clearly, multilateralism is one of Canada's most important brand attributes. And we heard Minister Gould speak off the top of her remarks very clearly that she and her government colleagues intend to leverage that long track record. And it's the specifics are that multilateral action is not charity, it's necessary. And that's no more obvious, as I'm sure everyone can appreciate, in the race for the COVID vaccine. No vaccine will be a panacea if there isn't equitable access. And if there will be no equitable access without global solidarity, which Canada can lead on. Using its attributes around being an equity leader. You might remember at the beginning, COVID was described as a great equalizer. And this has proved to be utterly false. COVID is the great unequalizer, an unmasker of inequities. inequities that were already present that are exacerbated both by the pandemic and pandemic responses. Thirdly, leadership. I mean, leadership is almost now synonymous with Canadianness. On an international stage where we have incredible Canadian personnel at the highest levels of global and multilateral organizations, but also, as I said, at the national level where there's been this really notable profile of women health leaders, which leads me to the piece around gender equality. This is at the heart of the Canadian case, the Canadian brand, if you will. And we're going to talk a lot more about that today. But it's even predating COVID, gender equality as a central plank of the Canadian case was also incredibly influential in helping others set their priorities during Canada's presidency of the G7, for example. And it chimes really well with the centrality of gender equality to WHO's priorities and the particular leadership of its Director General, Dr. Tedros. There's a lot here to be proud of in terms of Canada's track record on gender, lots to build on, which we're going to talk about today. And my final remark, which I'd like to suggest, is perhaps our most important. It's certainly the one that comes to my mind the most frequently, and that's self-reflection. As Canadians, as international citizens, and as health leaders, we have to be honest with ourselves about whether our actual contributions match our declared positions. So whether and how we can ensure our foreign aid assistance matches the role we envision and project for ourselves. Whether and how these bold and necessary commitments to feminist intersectional principles are matched by action, results, and accountability. In other words, we have to be self-critical. It's our responsibility as citizens and as leaders. I really think we need to push ourselves to ask tough questions of what the Canadian agenda is and what the results that flow from that agenda are. Fortunately, we have two of the brightest minds contemplating these issues, and they're here to share their research and expertise on the questions of the impact of COVID-19 on the global agenda for women's empowerment and Canada's feminist foreign policy. So first, we'll hear from Rosemary. So over to you, Rosemary.
Thanks very much, Jocalyn, and thanks very much, CIC, for inviting me here today. I'm delighted to join you from Baltimore, Maryland, in the United States after a very tumultuous week. But as Jocalyn has said, I'm originally from Canada, from Vancouver, from the Vancouver region. And I'm always delighted to be able to come back either virtually or in person to meet with fellow Canadians and to talk about Canada's space and leadership within global health. And I'm very delighted to be talking to you today about the gendered impacts of COVID-19, particularly in relation to the global agenda for women's empowerment, but also, in the context of Canada's feminist foreign policy. Because let's face it, COVID-19 is affecting all aspects of our lives, and we're going to need to think about how it's affecting, what are the impacts, and how are we going to need to change what it is we're doing, whether that's policy, practice, or within our own homes and lives as well. So we know from past and current experiences like that pandemics like COVID-19 are not gender neutral. There's a lot of data from Ebola, from Zika, for example, that we just know that pandemics are not gender neutral. Men, women, and gender minorities are differentially impacted. And it's important to think about how they're differentially impacted. So there are primary short-term and secondary long-term impacts that relate to social, economic, security, and health effects related to both sex and gender. And we need to look at it holistically because these are all very much interrelated. So primary short-term impacts include things like greater severity of disease and mortality among men in many countries, and as well as greater infection risk among women healthcare workers. Whereas the secondary long-term impacts are more related to the social, economic, and security of effects, which women do tend to be more impacted. These include greater economic insecurities, greater domestic violence, greater informal care responsibilities, among others. And, as Jocalyn alluded to, COVID-19 has not only shed light on, but has exacerbated existing structural and systemic inequalities worldwide, including gender and racial inequalities and the particular ways that gender is intersecting with other social stratifiers to create individual experiences of marginalization. So bringing in that intersectional perspective. So as a result of COVID-19 and our response nationally and internationally to it, we risk losing the already fragile gains that we've made on gender equality, which Canada's feminist foreign policy, as well as the Sustainable Development Goals, have advocated for. And we have seen change, albeit fairly fragile, I would argue. And Canada's feminist international assistance policy and feminist foreign policies provide a targeted focus on gender equality and women's empowerment specifically, with key emphasis on defending the rights of women and girls, particularly their sexual and reproductive health and rights, as well as women's leadership. So in that context, thinking about those key areas in relation to Canada's feminist international assistance policy in particular, what is the risk of COVID-19 to eroding efforts made towards gender equality and women's empowerment? So, well, evidence is showing us that women's sexual and reproductive health and rights are being directly challenged, both in high, middle, and low income countries. We know that health emergencies distort local health agendas, which with most local capacity and resources diverted to service immediate needs, and for good reason. But this does impact routine service provision, including maternal health care, including sexual and reproductive health services, for example. And the pandemic has put what is often considered to be non-urgent healthcare on the back burner. And often it's a lot of women's health related issues that are considered to be non-urgent. And we're particularly seeing that in the United States context with the closure of abortion clinics, for example. So for women's health, particularly the outcomes of this have been will be quite profound. Just thinking back to past pandemics like Ebola, for example, in Sierra Leone, we saw that maternal mortality was equal or even greater to the number of people who actually died from Ebola. And this was due not only to resources being diverted away from essential services like maternal health, but because women weren't going into the facilities to deliver their babies. And we're seeing similar patterns now with COVID-19. We also saw teenage pregnancy rates go up and a reduction of girls returning to school. We're seeing the same thing with data's coming out of places like Kenya, for example, similar patterns. Pandemics make it more difficult for women to access family planning and abortion services with general restrictions on freedom of movement, as well as disruption of production and supply chains. And I keep stressing this, that we are seeing similar patterns with COVID-19. So women's economic empowerment is also being directly challenged. Not only are women losing their jobs at a greater rate than men, but those on the front line are disproportionately women. The industries deeply affected by the virus include those in the service sector, like domestic work and childcare. And these are disproportionately staffed by women, the majority who are low wage and part-time workers, and many of whom are women of color. And again, we saw similar patterns during Ebola in West Africa and during Zika in Brazil. So this shouldn't be new, even though it's coming up as it is new. These patterns are not new. So women are losing their mechanisms for income and really being further reduced to poverty. And we know that the Canada's feminist foreign policy, for example, really does focus on poverty reduction by focusing on the rights of women and girls. What is COVID-19 going to do to those efforts? And we saw interesting, even during recovery, we're seeing greater impacts on women. So just think about, again, during Ebola in West Africa. So 13 months after the first case of Ebola was detected, while 63% of men had returned to work, only 17% of women had. And I think we're going to see similar things once lockdown is finished, once we're able to go back to jobs, due to women having to leave their work for childcare responsibilities. But so time will tell what the real impact of COVID-19 will be on women's economic empowerment. COVID-19 has also highlighted deep inequalities between and within global and national leadership. And Jocalyn also mentioned this, alluded to this when she was speaking. Especially in early days, women were absolutely not equally represented in decision-making roles to COVID-19. In some places it was 0 women, in some places it was 1 woman. And we know that representation matters. Who has a seat at the table determines which issues are prioritized. And when women or other marginalized groups have less decision-making power, less representation, either in households or in the government, we know that their specific needs are less likely to be met. This is one of the reasons I think issues like sex and gender have been ignored for so long, to be honest. So what the evidence is showing us is that COVID-19 risks eroding gains made towards gender equality. At the same time, however, it has drawn attention to intersectional gender equalities. And it has brought people together who are passionate about and working on these issues like never before. And I feel like we have a unique opportunity here. Jocalyn mentioned that I co-coordinate an international gender and COVID working group. It currently has over 500 members across academia, civil society, government, and multilateral organizations. And these are people who are working from diverse disciplines on issues related to health, social, economic, security, gendered impacts of COVID-19, not just the impacts on women, but also the impacts on men and impacts on gender minorities from an intersectional perspective. And by coming together and collaborating, we are really able to amplify voices and messages to really draw attention to the need for gender equality and women's empowerment. And this just shows the role and power of movements like this. If we are going to minimize the gendered effects of COVID-19, because it really is too late to completely eliminate them if we're going to be truthful, we need to act now to ensure that our pandemic response and recovery plans are gender sensitive. We have an opportunity to really ensure that our national as well as international foreign response to the pandemic considers and addresses the intersectional needs of women, men, and gender minorities, both before, during, and after pandemics. So also during the recovery phase. We need to ensure that Canadian feminist foreign policy works alongside things like the feminist pandemic response plans, like the recently published plan from the YWCA in Canada. And the Gender and COVID project that I'm working on recently published a brief which looks at lessons for feminist economic recovery from COVID-19, drawing on both the Hawaii and the Canadian feminist economic recovery plans. So if Canadian feminist foreign policy is going to advance gender equality and women's empowerment, it must do so in the context of the COVID-19 pandemic, utilizing these resources like these feminist economic recovery plans. However, we have to make sure that we take a holistic approach. We can't just respond to the economic recovery. It's also about the social, health, and security gendered impacts, the holistic, because all of this is interconnected. So COVID-19 is having and is going to continue to have a negative impact on gender equality and women's empowerment. At this stage, it's unavoidable. The question is, how bad is this effect going to be, and how long is it going to take to get us back to where we were before the pandemic started? Which, let's face it, we still had a long way to go even then. So we really need to use this opportunity to build back better, to ensure that the systems and structures in which we live and work are equitable for all. We need to use this opportunity to really address the structural and systemic gender inequalities. Otherwise, COVID-19 is going to have a long-lasting detrimental impact on gender equality and women's empowerment, as well as any gains made by Canada's feminist foreign policies moving forward. Thank you.
Thank you, Rosemary. That was like in equal measures kind of grim, but hopeful. And I have to say that one thing that you mentioned that really resonated with me, you called it an opportunity, which I think is why we're all gathered here today. And I think for me and many of my colleagues, we've been reflecting on how there's a sort of irony in that. There's been this long neglect of sex and gender, as you noted, but then when the gender or sex-related differences between infection rates and severity of illness, and certainly in death rates, began at the beginning of the pandemic, there became a lot of focus on sex and gender. That I love how you frame that as an opportunity. So thank you very much. So over to you, Julia. We look forward to your presentation.
Thank you so much. And I think that's a great place for me to be able to pick up on, because what I'm going to speak about is how COVID presents both challenges to Canada's feminist foreign policy, and it perhaps exposes some of the limits so far within that, as well as the opportunities it presents. So, as most people I'm sure on this, in this meeting note, Canada's had a feminist foreign policy for about 3 years now. There's been a number of assessments and reviews of that externally and internally. And I think what we can see is that feminist foreign policy to date has prioritized specific goals. So goals around women's economic participation in the formal workforce, women's political participation and involvement in decision-making. The international assistance policy has really focused on, doing development around maternal and child health. We also have the Women, Peace and Security agenda within that component. I think it is fair to say, and again, there's been quite a bit of research around this, that when you look at Canada's feminist foreign policy with a critical eye, you see that it's very much about women and about promoting women's engagement and involvement. So while the foreign policy uses language around intersectionality and applying gender-based analysis plus type approaches, many of the programs really focus on women. And, along with that, there's a lot of partnerships that are really going on around women's groups. So the government working with civil society organizations that take a rights-based approach or advance gender equality and women's rights in our partner countries. So if that's the context of the feminist foreign policy before COVID, then, we're almost a year into this crisis. And, as Jocalyn mentioned this is a moment, sort of a reckoning of, okay, where are we going? And how do we build off of the gains made? And Rosemary's really illustrated that many of the goals embedded in Canada's feminist foreign policy are threatened by COVID. When we think about girls' access to education, women's economic engagement. And so I think I want to speak to 3 sort of instances where there's this kind of tension, which we were just touching on, of both, a crisis or a challenge and also an opportunity. And one is this sort of broad threat to women's engagement in economic activity, in education, and also just access to health services. And I would say the first threat there, I think, is really a diversion of resources, which Rosemary mentioned. And I was really encouraged to hear Minister Gould mention in her presentation previously, that she actually started by pointing out that COVID is being layered upon other crises. So we're having other crises, conflicts in places like Yemen, food security crisis, and COVID is being layered onto that. And so it's really important for Canada's feminist policy, foreign policy and international assistance program to maintain the course of the previous goals despite this crisis and continue to focus on addressing those challenges. Our current international assistance policy does mention infectious disease outbreaks. And what it specifically says about them is that there's a need to strengthen health systems and address maternal and child health. And again, this is a great, a really important focus that needs to be maintained. But I think what COVID is showing us is that there is a need to look beyond maternal and child health, and women's health is much broader than that. And we need to consider the health of gender diverse people as well. So we're hearing reports around the world of people who are gender diverse not accessing testing and treatment for COVID because they're scared that they will be forced to quarantine with a gender they do not identify with, or they have a history of discrimination from the health system. And so I think there's an opportunity there for Canada to expand its focus around infectious disease outbreaks, to consider health issues that affect the gender dimensions of health more broadly. So there's a real kind of opportunity there. I think also in terms of the threats to girls' education, looking forward, our foreign policy really aims to focus on digital inclusivity. And I think there's great opportunities there to advance that because of the dire need for people to be able to access education while physically distancing or in quarantine or while we're having curfews and those sort of things. So the second area that I think COVID has really challenged many of the goals that Canada has been aiming to advance around gender equality, and again, provides an opportunity to kind of advance our feminist foreign policy, is around women's economic empowerment. And what COVID has shown, again, around the world, is that women cannot engage in the paid workforce. They cannot grow their careers and their income while also maintaining the burden of unpaid care work. And so feminist economists for a long time have been advancing arguments that we need to consider the care economy in our economic planning. And that care economy is the unpaid work that's done in the home. COVID has created a massive crisis in the care economy where women are leaving work because their children are not in school, their children are not in childcare, where the lack of health services means that women are taking on the unpaid work of caring for relatives and community members. And as long as economic empowerment programs ignore that unpaid work that women do, they are just layering the responsibilities and the burdens onto women. And so I think there's a real opportunity within Canada's feminist international assistance policy to recognize the importance of the care economy to women's economic empowerment, to take what COVID has exposed about how crucial and essential that work is to our society's functioning and build on it and support that work. And I think there's so many opportunities to do that by working with civil society and government around the world through everything from our bilateral aid programs to our international trade agreements to really advance a truly feminist approach to economic empowerment. So the third kind of instance I see where we're having this tension exposed that's also creating opportunity is around Canada's support for multilateralism and a rules-based order, which a number of the other speakers have already mentioned. And again, what COVID here has exposed from a feminist perspective is that there is still a lack of women's representation in those spaces. So when we're looking at global health governance spaces, when we're looking at who's making the decisions and the rules within this space, it is still very much dominated by cisgender men. And that is, I think that's been called into question by a lot of the fantastic organizations that are working in this space, like Women in Global Health and Global Health 50/50, that are really pointing out this gap. And at the same time, there's this fantastic momentum with the Gender and COVID Working Group, with people around the world calling for change. And being able to justify these calls for change that have existed for a long time within the context of COVID by saying women are on the front lines of this. They are providing the majority of healthcare. They need to be represented at decision making. And so I think Canada has a real opportunity because we have claimed a feminist foreign policy, because we are an advocate and a strong force for a multilateral order, to really advance those agendas. And we have a strong history, which has been, kind of outlined in the Lancet pieces and otherwise, of being a positive force when it comes to change within global health governance. So you can think back, as far as the Ottawa Charter on Health Promotion, Canada's role in promoting rights-based responses to HIV and AIDS, support from the Canadian government to civil society organizations involved in negotiations around the Framework Convention on Tobacco Control. There's such a long history of Canada playing a role to support, maybe not massive transformations within global health governance, but really positive ones. And I think that's something that Canada now has an opportunity to seize by joining this momentum for greater consideration of gender equality and gender-based analysis within the WHO and other global health governance spaces around COVID. So I'm going to leave it with that, but I just would, say that I think, as others have said, we're in this moment where there's a tension and a lot of threats to the goals we have espoused, but also really an opportunity to build on them and take a much more transformative approach. Thank you.
Thank you, Julia. That was fantastic. So two, really strong presentations, very complimentary, and just so many layers of detail, but also I think of things we need to be poking around in when it comes to Canada's leadership on gender equality and global health. I wonder if I can start with you, Julia. I'll sort of tee things up with a couple of questions that I have while I wait for participants to populate the Q&A or the chat box, please, with whatever questions you have for our speakers. So I just really feel like we need some foundations on the feminist foreign assistance policy in Canada, because it has received a lot of attention nationally and certainly globally, and it's held up alongside Sweden and Hawaii and others and helping fuel this sort of progressive idea of Canadian leadership currently. But can you take us back to what it involved in terms of new monies? Because as I recall, when it was first announced, there was concern that it wasn't a new financial investment, but instead a kind of rejigging of current foreign aid investments. And then can you give us a little bit more detail about the evaluations that you were describing? What's been positive, or what has worked from this policy and what hasn't? Like, what are the results and impact associated with this policy so far?
Sure, thanks, Jocalyn. So in terms of the commitments under the feminist foreign policy, we've seen since this government came into power, foreign aid allocations and international assistance has increased a teeny bit compared to previous governments, but it's still, only around about 0.25% of our gross national index. So it's not a huge amount. It's much less than countries like Sweden and others give. And we haven't seen, a proportional massive increase. So I think that's important to note. And in terms of evaluations of it, you can evaluate a foreign policy in so many different ways based on different outputs. There has been an absolutely wonderful compilation of articles about the feminist foreign policy recently published in a special issue of the International journal. And they're open access. I encourage everyone to go look at them. And there's some very interesting findings there about outcomes of the international assistance policy. So one that really looks at the perception of recipients of aid and have shown that, it has perhaps encouraged greater consideration of gender-based issues of women's economic empowerment in recipient countries and incorporating those into plans. So that's positive. The government itself, can give you if you go to the website, you'll see the numbers of increases in girls' education, investments in maternal and child health, and so on, which is all, good cause for how money is spent. I think what you can say from a more critical perspective is that it has very much focused on these specific goals. For example, as I mentioned, women's economic empowerment through formal, inclusion in the formal workforce, which you can see obviously the benefits of, but as I said, if you don't consider the broader context and what type of employment that is, what the security is, there are limits to how transformational those types of goals can be. So I think we see it to be very much, a specific type of feminist international assistance that's being implemented. And there's, you can weigh that a number of different ways.
Thanks, Julia. Yeah, if you don't mind putting in the chat details about that special issue, I think a lot of people will be really interested to learn about evaluations of this policy. Rosemary, I've got two questions for you. The first is from one of our participants called Maggie Zhang. And Maggie asks, what are the key actions that can be taken to continue to address gender equality? There are challenges in funding as it can be seen as competing for COVID interventions. Can you suggest any new initiatives to engage Canadian companies and NGOs for better coordination and collaboration globally? For example, a gender lens investment.
Just have to unmute myself. Thanks for that question, Maggie. I think we should always be asking that question: is what actions can we do? What, we can identify. It's all good to identify the problems and what the issues are, but unless we actually think about what can we actually do about them, nothing's going to move forward. I think broadly, the key actions at the moment is capitalizing on the momentum that we're seeing right now. As I mentioned earlier, the sex and gender are getting attention like I've never seen. I mean, even I've been working on it for many years before COVID happened, and I've never been busier right now. And I know it's the same for a lot of my colleagues. And in that sense as well, we're seeing the gendered impact of COVID-19. We are, the power of social movements, the power of networks and coming together and amplifying voices and advocating for change. We are seeing change happen. I mean, we've seen Dr. Tedros and the World Health Organization commit to looking at gender and COVID-19 and forming their own gender and COVID-19 working group. We're seeing, a lot of people interested in the issues, and first step is identifying what the problems and issues are, because we can't actually do anything about them if we don't have that evidence. There are challenges to funding. Is always going to be challenges to funding, especially for gender-related funding. And I think there's multiple reasons for that, due to what's prioritized. And to be honest, women's health, gender equality has historically been not unprioritized. Canada's a different story, but I'm thinking of the global sphere here. The issue, it's interesting to think about, though, that sort of the arguments that we can make to try to prioritize that funding, because if you think about the Sustainable Development Goals, yes, there's Sustainable Development Goal 5 is about gender equality, but I think it's 17 of the other goals have gender equality targets and indicators, whatnot in there. It underpins everything that we do. So I work in health systems and I equate it to that, but if we can address the root causes of the problems that we're seeing, we're going to have a much more long-term impact. But the challenges, yes, are with funding. Funding systems are structures right now. You get 3 years funding, you get 1 year funding, 2 years funding, 3 years funding. Are we going to change gender norms in 2-3 years? No, very unlikely, but maybe if we do it in those 3 years and then the next 3 years, and we build and we hopefully are going to see that change. I don't really have an answer for you for new initiatives to engage to Canadian companies and NGOs beyond our own gender and COVID-19 working group is really it's been a way to get people together who've never worked together before, never spoke together before across disciplines, because COVID doesn't just affect health. And to share what we're doing, to amplify messages, and to make sure we're not duplicating efforts, because I think so much of global health has been the duplication of efforts and waste of money as a result. And I think learning from examples like that will be very beneficial.
I think I might add to that just briefly, Rosemary, because something Maggie said made me think about the importance and the ambition of making the case for sex and gender related analyses to be central to everything we do, and not just because it produces, a remedy to this long neglect of women's health, but that it makes us more effective and more efficient. But I take the point very much that the funding priorities are all shifting toward COVID, and everyone is having to pivot the focus of their work is really devastating. But if we can build the foundation of sex and gender being, absolutely foundational to everything we do, it will produce, results that form the basis for therapeutics, for vaccine, for diagnostics, et cetera. That actually can be applied broadly across populations, which will reduce harm and reduce costs and that sort of thing. I want to put a question to you again, Rosemary, and then I've got one for you, Julia. But this one is from Douglas West. And I'll read his question and then I'll add my own. So he says, Douglas says, in your opinion, is there value in learning from intersectional and feminist health practices occurring in non-Western communities? How can we put away the lens of Western expectations? And I think this is a great question for you, because I think some of the work of yours that I have found so amazing is how you really ask that question of like, whose feminism are we talking about?
Yeah, thank you, Jocalyn, and thank you, Douglas, for that question. I think it's a really important question and a difficult one to answer as well, but important one that we must answer. Is there value in learning from intersectional and feminist health practices occurring in non-Western communities? Absolutely, yes. Yes, of course there is. I think there's value in cross-learning. I think there's so much has been north-south as opposed to even south-north, and that's been extremely problematic. I think when people often say feminism, they mean, actually, you have to think, what is the status quo? And the status quo is white feminism, especially in Western countries. And what does that mean? It means that specific groups have been marginalized from feminist agendas, which is why that intersectional lens and perspective becomes very important. I often say now, when I teach gender and gender analysis, I say that ethically, you're not doing gender analysis right if you're not bringing in an intersectional perspective. And that, we do have to ask who's feminism. And I think it's sort of two-pronged as well. So there's this idea of sort of identity politics. It's a bit of one of them. Who's feminists? Whose values are we putting forward? But there's also sort of thinking about what is the problems that feminism is trying to address? And that actually, this comes back to the feminist foreign policy in Canada. And also, if you think about the history of gender analysis, feminist studies, there's things like, I won't go into detail, but women in development, gender in development, you can Google and you can see how things have changed over the time. And I think that whose feminism from the point of the Canadian foreign policy, and this is a slight critique I have of it, is that it is focusing on economic empowerment of women and girls. It's looking at women and girls as a mechanism to achieve poverty alleviation, reduction, as opposed to addressing gender inequality as a goal in itself. So what that does is, if you were addressing gender inequality as a goal in itself, you are looking to address the systemic and underlying root causes, right? But if you are looking to address women as the drivers for change, to me that could be quite problematic, because you're missing power relations. Where are the men in that? How are they being engaged? Can we really change normative change that way? The other point of your question, but I just want to end on, and this is the tricky bit, how can we put away the lens of Western expectations? I don't know if that's the right question that I would ask. I think we have to ask whose feminism. I think we have to learn from feminist health practices in non-Western communities, but we also have to remember that a lot of these communities, like Canada, everywhere in the world, there's misogyny and patriarchy. It exists everywhere, and people are products of the environments in which they live and work, both women, men, and gender minorities. And it's thinking about equal rights to opportunities. And it's just what I say is, because sometimes when you go to certain countries and people say, well, no, we don't have gender inequality here. It's not a problem. Or they think, oh, feminist means you're going to come after men. There's so much misinformation about what feminism is. We need a common understanding in language. We need to make sure that we are working together. How we work together is what's most important. That we're not going into a context and saying you have to do it this way. We have to learn from each other, because otherwise, we risk perpetuating inequalities and hampering people's rights.
Thanks, Rosemary. Okay, I think we'll move to the last question so that we have a moment to close. Julia, you in your remarks, I think really drew our attention to the perhaps the relationship or the contrast between Canada's global feminist health leadership versus perhaps what it's doing kind of more in the domestic policy space. And I wondered if you could, in just the last remaining 2 or 3 minutes, tell us a bit about the policy coherence between that external global policy and the application of things like the gender-based analysis in commitments to Indigenous people's rights within our country. Can you talk to us a little bit about how those line up?
Sure. And I just wanted to, I wanted to say something about the last question too, because I think while Rosemary was speaking, I was thinking about how there's so much to learn about promoting gender equality and a truly intersectional approach from many of the Indigenous peoples here in Canada. So it's a non-Western approach, but there's so many opportunities to learn, partly about how to respond to crises like this, as well as alternative responses that can really advance gender equality. And this kind of ties into the second question about policy coherence and how we are promoting a feminist foreign policy and women's economic empowerment abroad in many of these goals, while here in Canada, we're also facing many of the same challenges, though in different ways and to different degrees. And, you know, for example, while we're addressing issues of food security broadly, we need to consider food security in Indigenous communities, particularly in the North, especially in this context of heightened costs and you know, disruptions in supply chains and all of this that have come with the context of COVID. So, I mean, there's a lot that can be said about Canada, the Canadian state's relationship with Indigenous peoples and Indigenous nations. And it's a very long conversation, but from my perspective, if we are going to apply a gender-based analysis plus approach, there needs to be a much stronger commitment to nation-to-nation relationships within Canada and to addressing many of those challenges that are being experienced in Indigenous communities. I think the other area that there needs to be more focus on policy coherence around would be our immigration policy and how newcomers and migrants to Canada are treated. You know, we're aiming to increase the number of people that come into Canada specifically to fill many of the jobs and roles that are needed within this context of COVID. And there needs to be a stronger focus on making sure those people's rights are protected. And many of those people are women that are going to be working in domestic sphere. So, you know, working in the care sector, either in long-term care facilities that are highly affected by COVID, or as nannies and housekeepers and those type of roles. And I think there needs to be a much stronger focus around ensuring those people's rights are protected. So there's many opportunities to look at, you know, connections between. I think the federal government has taken a strong stance around, for example, gender-based violence in Canada, and that there's some lessons there to be learned when we look outwards. And also our relationships with civil society organizations. So it's interesting to ask if the Canadian government has the same sort of relationships domestically with women's rights groups or groups advocating for gender-based responses as it does on a global level. So there's so much to unpack there, but I'll leave it at that.
Oh, I know. I so agree. I think it's something, actually, I'm so pleased that we ended on that note, because it's sort of an example of that self-reflection and the necessity and the importance of being self-critical that I really, you know, yearn for as a Canadian and a Canadian working abroad. So I appreciate those comments very much, Julie. I want to thank you both so much for your presentations. I mean, without a doubt, you're two of the leading thinkers on this issue. It's tremendously important, and I wish you all the best, and thank you so much for joining us. Now back to you, Liz. Thank you.
Thank you very much, Jocalyn, and I echo your remarks with respect to Julia and Rosemary, and yourself as well. All of the really thoughtful interventions, and the importance that women play in all aspects, and the consideration that women bring to so many issues that really is so often not given the importance that it's due, and especially in light of the COVID situation that really puts quite a lens on so many of the issues that this is a very important conversation, and I thank you very much for all that you have brought, and I would like to thank you all, and we look forward to bringing this all together as we look to the next phase of this exercise, informing the deliberative democracy side of it. So thank you all very much, and I wish you.
Well, thank you for having us, and I want to thank all the participants for joining us. It's really nice to be connected. So thank you again, Liz.
Yeah, well, thank you, and also would like to thank those who put this together, our program director Hamid Georgiani, and Samuel Amwa, our technical, and Daniel Lees in Toronto, and our communications Carolina Shimada. So thank you. Goodbye.
Good night.
Bye.